If you're worried about dementia, ask your medical provider about the screening tests. But what I want you to know, cognitive tests do not diagnose dementia, and misunderstanding them causes a lot of unnecessary fear. Today, I'll walk you through the most common screening tests and the factors that can falsely make someone look like they have dementia. My name is Slava Krinovich. I'm a nurse practitioner with over 20 years of experience and a daughter actively caring for an aging parent with cancer. On this channel, I translate complex medical and life systems into clear steps so adult children of aging parents, just like me, can prepare before crisis hits, communicate confidently with doctors and healthcare teams, organize finances, daily care, and support their parents without losing themselves. Let's start with something important and reassuring. There is a difference between everyday forgetfulness and dementia. Here's the simplest way to think about it. Alzheimer's isn't forgetting where your keys are. Alzheimer's is forgetting what a key is. Misplaced things, forgetting names, walking into a room and wondering why you're there, those things are incredibly common. Stress, poor sleep, anxiety, multitasking, even just being a human can cause all of that. Dementia, on the other hand, affects meaning, understanding, and function, not just memory. And yet many people hear the word dementia the moment the word memory comes up, which leads to fear, panic, and sometimes unnecessary labeling. That's why this conversation matters. Cognitive screening tests exist to help answer one question. Does this person need further evaluation? They're measuring tools just like checking blood pressure or blood sugar. Here's something I see often in real life. I encounter people who have been categorized as having dementia based on testing, only to later realize that when they were provided with social interaction, mental stimulation, hearing assistance, or calmer, more supportive environment, they're nowhere near as lost as the test results suggested. That does not mean the test was wrong. It means the context was incomplete. Cognitive tests measure performance in the moment, not a person's full potential. So, why context matters so much? Let's talk about some of the most common things that can make someone look more cognitively impaired than they actually are. Number one, social isolation. The brain is a social organ. When people aren't engaged, talked with, or stimulated, cognition suffers. World finding slows. Processing speed drops. Motivation declines. When social connection returns, cognition often improves. Second one is a hearing loss. This is huge and often overlooked. If you can't hear the question clearly, your answer may sound confused, even when your thinking is intact. Untreated hearing loss can mimic dementia, worsen attention and memory, increase cognitive load. Many wrong answers on cognitive tests are actually missed instructions. Number three is environment. Testing often happens in noisy rooms during rushed visits or stressful circumstances. A person who seems lost in a clinic may function very differently in a familiar, supportive environment. Another factor, especially for people testing at home, is attention deficit hyperactive disorder. Attention is not something as memory. If somebody has ADHD, diagnosed or not, it can absolutely skew results. And note, the disorder can develop in the adulthood. These tests depend on sustained attention, working memory, process speed, and task switching. Difficulty in these areas can lower scores even when there is no neurodegenerative disease. Poor attention can look like poor memory on a screening test. This is especially relevant for adults who were never formally diagnosed and have lived with attention challenges their entire life. It's important to reiterate, cognitive screening tests do not diagnose dementia. A concerning score does not mean someone has dementia. It means more questions need to be asked. If a screening result raises concern, the next step isn't label. It's more information. This evaluation may include blood tests to look for reversible causes like vitamin deficiency, thyroid issues, infections, or medication side effects. Brain imaging, such as MRI or CT, look for strokes, structural changes, or other explanations. The goal of screening is not to give people a diagnosis. It's to make sure we do not miss something we can help with. All of these tests we're about to talk about publicly available, and yes, you can look at them and complete them at home. I've included links in the description below. If you do take a test at home, the most helpful next step isn't Googling the score. It's sharing the result with a clinician who was trained to interpret them. Another important clarification, you do not need to see a neurologist or psychiatrist to do the screening tests. Your primary care provider can do them as well. Primary care clinicians routinely use tools like this and can help interpret the results in the context. Decide whether further testing is needed. Determine if referral to a specialist makes sense. Now let's talk about the tests themselves. First one is SLUMS, St. Louis University Mental Status Exam. It's a brief screening test that takes usually about 7 to 10 minutes. It looks at the memory, attention, executive function, orientation, problem solving. One important strength of SLUMS is that it uses different scoring cutoffs based on education level, which helps reduce false positives. It's commonly used in primary care and is more sensitive than older tools for detecting mild cognitive impairment. MoCA, Montreal Cognitive Assessment. MoCA is one of the most widely used cognitive screening tools worldwide. It assesses memory, attention, language, visual-spatial skills, executive function, abstraction, and orientation. It's particularly sensitive for early cognitive changes. Because it's challenging, even for healthy adults, it can sometimes feel alarming if taken without context. That's why interpretation matters so much. SAGE. It's a unique test because it's designed to be self-administered, often at home. It evaluates memory, language, executive function, and awareness. It's useful for people who notice changes but aren't ready to bring them up yet. It can also be helpful to tracking changes over time. Like all screening tools, it still requires clinicians' interpretation. And just final pearls of wisdom. Cognitive testing works best when it's interpreted through the lens of the whole person, not just a score. A low score should trigger curiosity, but not labeling. It's sometimes the most powerful cognition intervention isn't a medication or a test. It's connection, support, hearing assistance, and engagement. If you'd like me to go into the details of any of these tests, how they're administered, what the questions are really looking at, and how to interpret the results, let me know in the comments below, and I'll record a quick video walking through that specific test. Thank you for being here and for caring about your and your loved ones' health in a thoughtful way. If you found this video helpful, hit the like button, share it with a friend, and subscribe for more mindful health tips. And remember, joyful heart is the best medicine. Stay well. Till next time.